To the first measles death in our country in a decade, a child in Texas dying, part of the outbreak in that state that has seen more than 120 cases. The measles, as we know, eradicated from the U.S. in 2000. Our Rush Chef is here now with the increased concern. Good morning, Ariel.
Good morning to you, Robin. This is yet a grim reminder that measles is a preventable illness, but it can claim lives. That school-age child in Texas was not vaccinated. Measles, as you mentioned, was declared eradicated in 2000, which meant that there was no continuous spread of this virus for more than a year. Now health officials are urging the vaccine is still the best way to save lives and preserve immunity.
This morning, the urgent race to contain the spread of the measles, as a severe outbreak in Texas has now turned deadly, claiming the life of a school-aged child. Health officials confirming the young patient was not vaccinated. The CDC saying this is the first measles death in the country in a decade. Doctors in Texas say they've admitted more than 20 kids to Covenant Children's Hospital in Lubbock, all of them not vaccinated.
The vaccine that we've given for 50 years. It is one of the most effective vaccines we have on the market.
Early signs can include high fever and cough, then a rash of red spots. The CDC now reporting 124 cases of the highly contagious disease centered in West Texas. And concern is spreading, but Health and Human Services Secretary Robert F. Kennedy Jr. appearing to downplay the risks.
It's not unusual. We have measles outbreaks every year.
So for some context here, all of last year, the U.S. had 285 cases of the measles. Right now, just in Texas alone, they have reached almost half that number and counting. Health experts we talked to emphasize that the measles vaccine is extremely effective. Having 2 doses can give you 97% lifetime immunity. That is why doctors are urging those who aren't currently vaccinated to get their shots as soon as possible.
Who is most at risk?
Yeah, of course. So we're talking about young children, specifically those who are unvaccinated, those who are immunocompromised. Remember, this shot is first given between a year to 15 months, and babies aren't protected before that. Then there's a booster shot that happens between 4 to 6 years old, and that's when the kids actually reach full protection. So we have to be vaccinating children. It's really very vital. This has been a safe vaccine for 50 years. Doctors say speak to your healthcare professional about what's right for you.
And it's so surprising because measles had been eliminated in this country.
Yeah, exactly, since 2000.